Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. Thank you very much for watching our video today. It's another subscriber questions answered video. This is our third episode. If you've missed the first two, I'll pop a link to them in the description below. So our first question today is from Hannah Bright. Hannah would like to know is how would you know that you have an ear blockage, and how serious does it need to be to get it removed by an audiologist? Thank you very much for your question, Hannah. What we would normally say is that the first sort of signs and symptoms that you pick up with any kind of blockage in the ear, whether that's wax, infection, anything else, is that you normally get a little bit of reduced hearing. Okay, so as soon as that wax gets big enough to block the ear canal, it's going to vastly reduce your hearing. So if you start to notice that everything's starting to sound a little bit dull, then it might be worth going along and getting your ears checked out. As far as how bad does it need to be before you get it cleaned out, the ear canal can normally expel up to about 70% of its total volume in wax. So if you've got up to 70% full, then the ear canal can cope quite well with expelling that on its own. So if you can see quite a portion of the eardrum, that's what the audiologist is going to be there to check for you and to make sure that you get your ears nice and clean. Our next question is from DFK411. They asked, how often do we see people with ear infections? Can ear, nose and throat consultants remove them themselves, or do they refer to us? And do ear infections always result in a blockage of the ear canal? There's quite a few questions in there. So the first one is, how often do people come to us? We do see people with things like ear infections, fungal infections in the ear. Probably we may do maybe a case, maybe 2 patients a week, something like that coming through. They do normally result in a blockage to the ear. Now, you can sometimes get a liquid discharge from it, especially if it's an outer ear infection. So what you'll see is a little bit of what's normally a discharge that's got quite a pungent smell to it coming out of the ear. So having all that debris and liquid blocking all that ear canal can cause a reduction in hearing. As far as whether ear, nose and throat consultants will refer to us, most ear, nose and throat consultants will be able to suction an ear as well. So they will normally do it themselves if you come along. Obviously we can't prescribe things like antibiotics. Well, certainly here in the UK we can't anyway. We can't prescribe antibiotics or any kind of treatment. That's all we can do is remove the blockage itself. The next question is from Misery is Beauty, and they've asked, is there any genetic, biological, dietary or environmental conditions that affect wax production? Now this is something that comes up quite a lot in the questions, and lots of people ask why there is a difference sometimes between people's earwax production. Earwax production is a very personal thing. Now, the amount of wax you produce, it varies so much from person to person. It can even vary quite a lot from ear to ear. There are certain aspects of things like genetics. So what you'll find is if you're of an Asian descent, then your earwax will tend to be a lot drier, a lot flakier. You tend to have to use things like Jobs and Horns a lot more just to clear that out. But as far as sort of general environmental conditions, not so much. If you work in somewhere that's very dusty, I suppose, or if you're working in very dry conditions, then you're more than likely to dry that earwax out, so you're more likely to get blockages that way. But it's such a personal thing. It's such a personal thing. The next question comes from Suzanne Webb. Suzanne wants to know, is having little or no earwax a problem? The answer is no, it's not a problem. You too tend to find people that don't produce as much earwax will tend to have a little bit of dryness, maybe a bit of itchiness to the skin in their ear canals. But unless you're getting problems with infections or other issues, it doesn't matter. It's such a personal thing as to how much you produce. Some produce hardly anything at all. Some produce absolutely loads. So it really doesn't matter. As long as your ears are looking healthy, the eardrums are looking good, which your audiologist or hearing care professional can take a look at for you, then it's absolutely nothing to worry about. The next question comes from Sarah Lichtenweiler. She wants to know, have we ever taken bugs out of people's ears? The answer is no, we haven't. Luckily, I've never seen anything looking back at me when I look into the ear. But some of my colleagues have removed some interesting bits and pieces from ears, and you do see some unusual things in there sometimes. So you will come across bugs and other bits and pieces in the ears, and in extreme cases you can see some quite nasty stuff in there. But here, we've never taken anything out. Most people, if they were having an issue with what they felt that something had crawled into their ears, they would go along to the hospital to get that removed normally. Our next question comes from Chris Jackson. Chris Jackson came up with a really interesting question, which is, do ear candles work? Is it safe? So In our experience, we don't promote ear candling as a way to remove earwax, and we'll find that a lot of hearing care professionals don't either. What we find is that what you see when you take the candle away and you split the candle open, which is what they show a lot of the time what's inside, it's actually the wax from the candle itself rather than earwax that's inside the candle. As with anything else, we do have some patients who swear by them and they find it really works for them. And I think a lot of it is down to the practitioner maybe that's carrying it out. But from our perspective, we don't actively recommend them. As far as is it safe is concerned, as with anything else, it depends on your practitioner. We have seen some cases where there's been some wax from the candle dripped into the canal, which is really uncomfortable and really painful for the patient. But yeah, as a whole, it wouldn't be something that we would recommend, Chris. Now, the next question comes from Francesca98. There are lots and lots and lots of you asking this question out there. She wants to know, does the earwax ever smell? Have we ever come across smelly earwax? No, earwax doesn't smell. Even if it's really old or if it's really wet, as we're taking it out of the ear canal, you don't smell anything at all, and you wouldn't smell it on the patient either. The only time we've ever come across smelly earwax is if we have an infection that tends to be trapped behind a blockage of wax, because what happens then is the infection permeates into the wax, and because ear infections tend to have quite a pungent smell to them, that's when you'd notice the smell coming from earwax. But in the majority of cases, doesn't smell at all. The last question we've got today is from Peggy Mead. Peggy asked about, she had a problem with calcium deposits, perforations from repeated infections when she was a child. Is there anything you can do as a parent to minimize the number of infections in children? This is quite a difficult one to answer. Obviously, every case is different, and we would give you some general advice, but obviously always take the advice of the hearing care professional. They're the ones looking in your child's ear. They're the ones that can give you the best advice. As far as general advice is concerned, ear infections are really common in children, tends to be sort of around about that 2 to 3 years of age. You tend to get clusters of infections coming together, which is quite common. And the only way to sort of try and reduce those number of infections, a good bit of advice is to try and keep those ears in that child as dry as you possibly can, which can help to sometimes minimize the number of infections you're getting. As far as whether those infections can cause calcium deposits and perforations, they can. I mean, anything that aggravates or damages the skin of the eardrum can lead to a slight thickening of the drum, so you get these white cloudy patches on the eardrum, which is what I think Peggy's talking about as far as these sort of calcified looking deposits on the drum are concerned. And in extreme cases, especially with middle ear infections, you can then also get perforations to the eardrum where the eardrum bursts to release the pressure of the infection behind it. So I hope that answers your question for you, Peggy. There were loads of questions that came through this week, and I struggled to answer them all. I just picked out the ones that I could go through quite easily and quickly with you guys. Obviously, as promised, there will be some more in-depth videos coming up over the next couple of weeks when I get a chance to sit down and do those for you. If you have a question, then by all means pop them into the comments section below. It's always great to hear from you guys. You guys have done a fantastic job of promoting the channel. We've got 62,000 subscribers now, which is immense. That's really good. And that's all down to you guys and all your hard work of sharing, liking, and really getting behind the channel. So we really appreciate all your help from that. So as always, guys, until the next time, take care.